My name is Seke Kazuma. I'm from Zambia in Central Africa, and I'm here in Mumbai, India at Tata Memorial Hospital on the African Merck Oncology training sponsored by Merck Foundation. So I made my intentions known to my government that I was interested in doing super specialty training in cancer surgery, and they put me on the waiting list to see if any opportunities come up. So I was contacted by officials in the Ministry of Health that I had been selected for this training. So in the past, we had a lot of infectious diseases, but now non-infectious conditions are rising. So we have so far, since establishing a cancer disease hospital in 2016, have recorded about 26,700 cancer cases in Zambia that are receiving treatment. And a year we record about 3,000, and a month 250 new cases. So the burden of cancer is real, except that this is not reflecting the true picture on the ground, because there are more cancer cases that are discovered in an advanced condition and therefore are not referred for specialized treatment. So this is not a true picture. We'll have to do more studies to get the actual numbers or the cancer burden in Zambia. We have a population of 18 million, and so far there's only one cancer diseases hospital that offers radiotherapy in Zambia. At different levels, all hospitals play a part in treatment, but the specialized hospital is only one, where there's 8 radiology medical personnel, there's 5 surgical oncologists, 2 gynae surgical oncologists, 1 pediatric oncologist. In brief, obviously numbers are not enough, and the ministry has a vision to improve the cancer services or cancer management services in the country. Okay, first of all, Merck Foundation is doing a noble cause for Africa. I think this needs to be highly commended at all levels, to be able to sponsor people and bring them up for super specialist training. And I think this speaks to our plan, the National Surgical Obstetric Anesthesia Strategic Plan of 2017 to 2021. In this strategic plan, it has been established that 74% of the population have no access to safe surgery, and let alone oncology surgery, because a population of 18 million only has 2 surgical oncology surgeons. So I feel that Merck Foundation is giving us an opportunity to give skills to African doctors who are going to manage cancer. And the big picture of this is speaking into universal health coverage for Africa. So I made known to my government that my area of interest was general surgery and oncology training in general surgery. And the offer I got from Merck Foundation was gastrointestinal surgical oncology. And this spoke to what I wanted. So when I finally, we've heard a lot of good things about India, and it's a destination of medical tourism. So all our patients are referred to India because They are competent, they've got good skills, and their outcomes are very good, and they are cost effective. One of the major changes is, first of all, in the practice of surgery, because now we are more dealing with the protective equipment, and also the new methods of infection prevention, wearing masks and keeping social distancing, hand hygiene. So the patient load in our clinics has been reduced. The number of operations we are doing has also been reduced. But one thing that has come on top of it all is that the learning has continued. We have actually made a lot of progress in this period. My advice to the trainees from Zambia is that, first of all, this is an opportunity. In my opinion, the best way to use is a blessing in disguise. I think that this is an opportunity that should be taken seriously, and appreciating the magnitude it has, because it has given me what I didn't have, and I don't think anyone else would have given me. It has given me skills in surgical management. It has given me exposure to how cancer is treated, which is going to benefit the population of Zambia. So in every environment of learning, one needs to know what they need to get. They need to set their objectives right. They need to be assertive and not reactive. So when you go somewhere, you demand what you need to learn. You don't wait for it to be given to you on a silver plate. Then you make your presence known, and keep yourself available, and be humble. I'm coming from a situation where I was a consultant. Now I'm here, I'm a trainee, but I haven't had problems fitting in because of humility. You need to be humble, and you need to be receptive. And if you apply these, it will be possible to learn. So this will be my advice to the future trainees from Zambia. Yeah, I think the biggest gratitude should be given to Merck Foundation, because I know that this is an expensive project to train Africa to undertake the African Merck Oncology training. This is a very big and expensive venture, so we need to applaud them with a big gratitude, thanking them. I also want to thank the First Lady Office on behalf of my government, who's taken the initiative to take lead in this campaign against cancer, to offer training to cancer patients, cancer survivors. I also want to thank sincerely Tata Management Center and their management. They opened doors to me and treated me like I was one of them. There was no difference in the way I was treated, the facilities I was given, and the privileges that I enjoyed, the same as the privilege every other Indian trainee enjoys. And for this, I want to thank them sincerely for this opportunity. Zambia